Hello, everyone. Good morning. Welcome to another session of AMA with Dr. Ben Benham. I'm Dr. Ben. I'm the board-certified dermatologist. I'm one of the co-founders of Happy Head. Welcome. And Evelyn's right here. Our assistant was here every week and helping us out. So, Evelyn, what's the topic of today?
Today we're going to start off with what makes Happy Head products different from other brands.
Oh, great question. So first of all, we were one of the first topical financial solutions in the market in 2020 that was marketed nationally. Number two, we're a customizable product, which means that if you are using the product and there's an issue with it, we could remake your bottle and take those ingredients out and adjust those ingredients just for you. So it's customizable. So let's say if you use the minoxidil and having some irritation from it, we'll take it out. If the redness causes some irritation, we'll take it out. If the finasteride needs to go a little up higher or lower, we could adjust that. So we are a customizable topical finasteride solution. Our bottles doesn't sit years basically on the shelf. It's literally made just for you and shipped out. Okay, so please demonstrate how to use a dermal roller and the time and the force needed. A great question. Here we go. Okay, guys, here's the Happy Head dermal roller. Take it out. Okay, so first, a dermal roller comes about 540 spikes at the tip, and this is the 0.25. So the way you're going to do it, you just go, and the pressure is going to be light. It's the same pressure you're going to apply your deodorant. Go up and down like that. And look, right now I'm doing it. It's really not hurting that much. I mean, unless when I get on my forehead, but really on my scalp doesn't really hurt that much. I go left and right. Go side and side. And that's it. Again, force very light pressure. You could do about a minute on each side. And again, just don't make yourself bleed. Some people love to use the higher dose dermal roller, the one with a depth of 1.5. I disagree. I think you should use the lower depth and just keep doing it basically every night. That's a great question. Thank you. I'm 56-year-old. I've had hair transplant surgery back in my 30s. Can I see any measurable results with your product? I mean, it's possible, yes. I mean, see, the problem with having a hair transplant is that, let's say if you transplant the front, but you still have a potential of losing all the stuff in the back. That's what the transplant is not a solve all, treatment. So you still probably have to do something to prevent your other hairs in the back that's not transplanted basically from falling out. And also over time, some of those transplanted hairs will also miniaturize. So yes, using the Happy Hair product will help both the transplant and non-transplanted hairs, unless you're complete bald. Then in that case, it won't help you. What can be done to stop scalp inflammation? I've used steroid cream for 4 months and I can still feel the inflammation. So I'm assuming that you're currently not happy and I still have inflammation. So one, we could switch you to what's called the Aqueous water-based formula. Reach out at help@happyhead.com and tell us that you want the water-based formula. Also, you could wash the product out after 1 or 2 hours. You could do it once a day and not twice a day. Also, there is a Head and Shoulders scalp soothing serum that you could just buy on Amazon. It's like $12, and it basically could help soothe the scalp as well. Also, we could reduce the minoxidil concentration to 6% or even completely take it out, and also take out the retinoic acid. So reach out to us at help@happyhead, and we'll get you started basically on what we're going to do. I've used finasteride internally for many years. At first, it worked and it worked well. That was the mid-90s. Slowly, the improvement diminished, now continue to lose. Is there something about the finasteride in which we can develop a tolerance? Yes. You will develop a tolerance on basically what is called a plateau phase on oral finasteride. It may also be topical too. So for you, the best thing is not to stop the oral finasteride. Do not stop. It might seem that you're losing more hair, and you probably are. But if you were to stop, since you've been on ever since 1990s, you're going to shed a lot. So don't stop the product. Number two, we have seen that if you are on oral finasteride and add topical, the topical will make the oral work a lot better. So get a Happy Hit with finasteride and use it along with the oral finasteride. Do that for about 4 to 6 months and see how you do. If you see you're not seeing much improvement, then the other thing to do is to add oral minoxidil to your regimen or switch you out from the oral finasteride to oral dutasteride. But the first thing I would do, I would add topical Happy with finasteride to your regimen. And do not stop the oral finasteride. After whole transplant, will using Happy Head help? If so, how long should I wait before adding it in? It's usually 6 weeks. Yes, we do a lot of hair transplants in the office. We usually tell our patients to wait 6 weeks before you add in the topical Happy Head. I've been using the Happy Head top for about 4 months. I was getting great results, but as of last week, I'm shedding. I had an initial shed when I first started, but then I experienced hair growth. But as of the last 10 days, it appears that I'm going through another shed. Is this normal? Yes, it is normal. You don't have to change anything. Just go through the shedding. Your hair just is going to go through many different hair cycles. So you're just going through a hair cycle right now. So that's what it is. See how it does for another 2 months, like 4, 6 weeks, or 8 weeks. If we feel basically that the shedding continues and you're not getting out of this shedding cycle, then probably adding oral minoxidil to the regimen could help you a lot. Thank you for that question. What is the optimal amount of time to leave the Happy Hair Serum in? I don't really like how oily it makes my hair. So you could leave it for 1 to 2 hours and then wash it off. I mean, as simple as that. With respect to the oiliness, we could probably take out the aloe. Everyone, I think it's the aloe that's causing the oiliness. So you could request to take the aloe out and it will make it less oily. The reason why the aloe is in there is basically to reduce irritation. Um, so wash it off after 1 to 2 hours. You can also request to take the aloe out. Just email us at help@happyhair.com. Why can't we increase the dosage of oral minoxidil 2.5 and the fin 1 milligram? Can take more than one tablet at a time. So you're talking about the super capsule. So if you look at the clinical studies of oral minoxidil, chronic use of low dose oral minoxidil was the one that really helped patients quite a bit. So it was really between the 1.25 to 2.5 milligram. There are some patients that are on a higher dose. Honestly, your side effects of blood pressure changes will go up higher. And I'm not sure if really it's going to give you much added benefit. With respect to finasteride 1 milligram, again, similar thing. In clinical studies, it's been shown that for males, going above the 1 milligram finasteride tablet will not increase your efficacy, but it could just increase your side effects. Now, that's different for females above age 50. For females, you could actually go up higher to 2.5 milligrams on the finasteride dose, but not for males. It doesn't show basically that going up higher will help you at all. So again, so for guys, minoxidil 2.5 and finasteride 1 milligram, those are usually the maximum like high ceilings that we use. How many times a day do you use a derma roll? Just once a day. I would probably recommend at night. So apply basically a topical happy head and gently basically roll. Again, guys, the key word is gentle. How to differentiate between normal and excessive hair loss? So great question. So look, you could lose about 100 hairs a day. So if you lose my 150 to 200, that's definitely more. That's you're shedding at that point. And also, there are many different reasons why people shed. Look, it could be stress from work, it could be stress from home. It could be traumatic events like car accident, rapid weight loss, COVID vaccine. And it could be a combination of all of them. Is it true that oral finasteride doesn't work as well for men over 60? No, actually, that is not true. Um, I have a lot of patients above 60 that use it in my own personal practice, and they do just fine. The key is how much hair you have to begin with. I mean, look, if you don't have a lot of hair and you're bald, it doesn't matter if you're 30 or 60, no hair is going to grow out. If you have a lot of hair at any age, I think you're still going to get good results. Now, that being said, I think if you're younger, you will see better results. But you still should see, most patients should still see probably good results even in their 60. Also, so the topical is interesting because when you apply topical finasteride, you're applying it exactly where you need it. So some patients, actually most patients, probably sometimes see better results by using the topical compared to oral because when you take the oral, it has to go through the entire body system before it gets to your scalp. And if you really want to see the best results, doing the oral and topical finasteride will probably give you the better results. If I'm already on a blood pressure medication, is adding minoxidil another blood pressure medication dangerous? If so, what would be the side effect of too much medication? Well, the side effect would be dropping your blood pressure, making you feeling dizzy or lightheaded. That being said, one, you should run it by your doctor that you want to add oral minoxidil. Two, oral minoxidil 2.5 milligrams is actually a very low dose. So if you talk to your family practice doctor, they will tell you that to really get the benefits of blood pressure medication, of the blood pressure effects from minoxidil, you actually have to be taking like around 5 to 10 milligrams. So 2.5 is a really low dose, but you should probably talk to your doctor. Sometimes your doctor, most of the time, your doctor will say it's okay. Sometimes they will adjust the other medications, and you can also buy blood pressure medication at home and check your blood pressure as well. But again, I have a lot of patients that are other blood pressure medications all the time, and we put them on oral minoxidil. I just have them always check with a regular doctor, the doctor that put them on the other medications. Is there a difference in treatment if the hair loss is not continuous? Do people with occasional hair loss still need to continue taking it to maintain the hair? Good question. Um, I mean, usually the hair loss is kind of continuous. Um, but I mean, if you go through various shedding phases, then you could probably probably use the product when you're shedding, but that's usually not the case. The problem is the product doesn't work overnight. You really need about 4 to 6 months of continuous active use for the product to work.
So for like people that had COVID-related hair loss, that I would consider.
Yeah, so that's a very good question. So if you have COVID hair loss, uh, you could possibly use the topical for 6 to 8 months, and once your hair comes back and the shedding decreases, um, then then you could potentially stop. Yes, in that situation, that is possible, but that's a very unique case, though. This is a very unique case. Um, Good question, though. I have a 0.3% of finasteride in my formula. Is that equal to the standard 1 milligram? It doesn't work that way, but it's pretty much similar. Yeah. So if you look at the clinical studies, basically in the CMDHT, we realized that patients that were taking the 0.25 gave very equivalent serum DHT. Basically concentrations compared to the oral basically finasteride. Hydralazine is also a blood pressure medication, similar in structure with minoxidil. Do you have any opinion on this? No, I don't. I don't think that hydralazine basically resulted in any hair growth. Um, but I will look that up. Can depression alone cause hair loss? Well, if it's not depression, I mean, it's more like anxiety. Patients that tend to be more anxious, basically, do tend to have more hair loss. So when someone comes in my office and they're very stressed and they're anxious, I sometimes do put on Zoloft to reduce the anxiety, and their hair loss gets better. Obviously, if you are very depressed, yes, that could also lead to hair loss as well. Is it true that the hair follicles on a perimeter of your scalp tend to shed or break faster? Uh, Not necessarily, but usually those are the ones basically that some patients may lose initially. But you could also basically a lot of patients go bald right here, and that's on the perimeter. So that is not necessarily true. Sorry, guys, I'm reading a question right here. Okay. What is female pattern baldness? So there's a difference between male pattern and female pattern. So male pattern basically typically patients lose their hair in the widow's peak and it goes back, or you're losing the crown. Female pattern usually females you lose the hair basically right here on the top and they maintain the frontal hairline. Now males could have female pattern hair loss and females could have male pattern hair losses, and we see that all the time. But typically that's a distinction. Spironolactone, which is an androgen blocker, what exactly does that mean? So, good question. So, spironolactone blocks your testosterone from binding to testosterone receptor. So, if this is testosterone, it's going to prevent it from binding to the receptor. Finasteride is a DHT blocker, which means so you have your testosterone, it has to get converted to DHT, and the DHT that's binding to the hair follicles causing the hair loss. But you're stopping the DHT formation. So the mechanisms of actions are different. Can breastfeeding cause hair loss in a postpartum period? Is spironolactone safe? If not, can laser cap be safe? So, a couple questions. So first of all, in the postpartum period, it's not the breastfeeding that's causing it. It's just the entire pregnancy. It's the action of delivery that's basically causing the hair loss. So typically by 3 months after basically someone gives birth, patients go through a telogen effluvium, and so it's the birthing experience that's causing the hair loss, not the breastfeeding. Number two, spironolactone is definitely not safe during breastfeeding. Not safe. You cannot take spironolactone, oral nor topical, but you can use laser cap. I think that's pretty safe. I would like to have testosterone in my next formulation, of course. We could do that. Can you mind just connecting him? Yeah, can you please email help@happyhead.com, and they will basically go ahead because they have to change the formula. So, and the way it works for just our users, when you guys request a formula change, it's not like we could just change the formula. We actually have to go back to your doctor, request it, and the doctor has to approve it. So remember, these are all prescriptions. Every month you get the product, there's a prescription written or refill written for that product. So yeah, please email us, and we'll take care of it. Again, help a happy it. Hi, my first time on this site. Is Keeps a good shampoo to use? So good question. So that's a good question. So the Keeps shampoo is actually prescription natural shampoo. No, the Keeps is a prescription ketoconazole shampoo, and we have that too. So if you just email us at help happy it and say, look, I want the prescription ketoconazole shampoo, we'll be more happy to send it to you. We also have our own non-prescription shampoos which we developed that has biotin, collagen, keratin. Like it's a biotin collagen shampoo, and that could help a lot as well. Isn't thinning areas just areas that will eventually go bald? They say you can't bring back hair follicles, but the formula is supposed to work in thinning, but not bald areas. I guess I'm confused. Okay, so here's the difference. So hairs basically go through what we call miniaturization step, which means here's a hair follicle, and then basically they slowly get smaller and smaller and smaller, and they get miniaturized. And what's causing that is testosterone. So now, but there is a point where if you get really past beyond that miniaturization, so if you get really, really tiny, it won't work at all. So when we actually examine patients' scalp on a daily basis, we see this miniaturization right away. Probably I might bring in my magnifier next time. I mean, we could probably look at it, so patients get a better understanding of what's going on. So the whole point is that if you're past beyond a certain point, that hair will never come back, and that hair is technically dead. But if you're before that miniaturization step, what you could do is that basically when you start using the topicals, you could reverse that miniaturization. That means take the hair that had gone smaller and basically reverse the age and thicken it up and thicken it up. So again, the way it works at DHT constantly binding to hair follicles is negative effect on the hair follicles. But if we take the DHT away, we take away the negative effects and the hair grows back. So we have two scenarios: a guy who's just thinning on the scalp, but a lot of hair is there, but he's just thinning. Another guy who's complete bald. So in a guy who's bald, there are no hair follicles. You can't bring any of those hair follicles back. Those hair follicles have gone beyond the point of no return. In the case scenario where it's just thinned out, the hair follicles are still there. They're just smaller, what we call miniaturized. So those, by inhibiting the DHT, you can reverse that miniaturization and basically reverse the thinning process. I hope that explained it. And this is why when people send us their photo, and like if they're bald, look, it's not gonna help. There's nothing that Happy could do to bring those hair follicles back. So the Happy Head, or actually in fact any product out there, or even any procedure like PRP or stem cells, what is really gonna help is if you have miniaturized hair, which means clinically, when you look at someone, the hair is there, but it just stand out. Should I change my diet or hair care routine? Good question. I mean, it depends what your diet is. I mean, if you're eating like a lot of processed foods, creatine, high in soy milk, a lot of energy drinks, you do exogenous testosterone or TRT treatment, yeah, all those gonna damage your hair. I would probably stop that. Your hair care routine, again, it depends what you're doing. If you're blow drying your hair basically all the time, if you're an anxious person, you're constantly touching your hair, pulling on your hair, if you have your hair in tight braids, yeah, those are also going to damage your hair. You should also change your hair care routine. So it's not one or the other. It could be both. It really depends what you're doing. Is it true that saw palmetto to combat hair loss related to hormonal changes in perimenopausal and menopausal females? So saw palmetto. We should probably just have a talk just on saw palmetto. So saw palmetto, look, could help a little bit, but I don't think it's really that that great in helping. There are some studies on it. It's not that amazing. So, you know, mm, that's my answer for it. If it doesn't work on fully bald areas, does that mean it wouldn't work on alopecia areata? Correct. Correct. So actually, the literature is kind of divided. So alopecia areata is an autoimmune condition, and what it is that you really haven't lost your hair follicle in alopecia areata. So, but I have alopecia areata, by the way, and you could see my spot right here, right there, guys. Um, the way alopecia areata works is that there's a lot of inflammation underneath the skin around the hair follicles, which is putting a negative impact on the hair follicles to grow out. So by using injectable steroids to reduce that inflammation, it allows the hair to grow back. So alopecia areata is technically different from someone who's complete bald. If someone's gone complete bald, there are no hair follicles. Alopecia areata, the hair follicles are there; they're just being prevented from growing out. Now, topical minoxidil, there are many different studies. There's some studies that show topical minoxidil in alopecia areata does not work. And there are actually some studies that if you use dermal roller with topical minoxidil, it's going to work. So I think everyone's different. If you do have alopecia areata, you should probably try Happy End and see if it works. But typically, we don't go around saying, oh, yeah, if you have alopecia areata, use Happy End. So what's the difference between Happy End Super Capsule and a Happy End Vitamin? Which are the most effective? While using the Happy Head topical conditioner formula. So the Happy Head multivitamin, it's just a happy. It's just a multivitamin. Basically, it's vitamin. It's biotin, collagen, probiotics, vitamin A, B's, all that stuff. The Happy Head Super Capsule is a prescription product where it has three things in it. One is oral finasteride, number two, which is prescription. Number two, oral minoxidil, which is also prescription. And we have added vitamin DT3 2000 IUs. So it only has actually technically one vitamin and two prescription grade products. So they're complete two different things. So if you're using the kitchen sink and you really want to basically supercharge it, I would do the super capsule. But you could do super capsule and the vitamins as well at the same time. It's really not they're not exclusive. I would probably just check the vitamin D level to make sure you're not overdoing the vitamin. What kind of tests do I need to figure out the best treatment? What tests are the most common for your patient? So typically, if look, we sometimes do lab tests. I mean, not all the time. It really depends. And it depends if you're male, if you're female. It really depends. I mean, you're more than welcome to kind of call with me and we could chat a little more about it. But again, we typically test vitamin D, iron level, and thyroid levels. Um, and it's really just looking at so the key is really just looking at your scalp to see basically what you really need. I mean, look, if you're completely bald, you're not a candidate. If you're thinning but you still have some hair, then you're a candidate. So this is important too. You could either send your photos to help@happyed.com and I'll be more than happy to take a look, or somebody consult online and your doctor will look. Is Happy Head covered by insurance? Unfortunately, no. I'm so sorry. Um, is there a chance that someone may not respond to topical or oral finasteride or dutasteride? Yes, of course, absolutely. I'm on oral finasteride for 3 years, topical mint for 3 years, topical happy occasions for 4 months, plus keto shampoo and microneedle. Feel as though I'm not a good responder since nothing stops or regrows hair from me. Unfortunately, yes, it is possible. The only other thing I would do, I would actually add oral minoxidil to your regimen and see if that makes a difference. I mean, you're already doing everything. I would just add the oral minoxidil, and sometimes that could really, that could really help quite a bit. That's a very good question, by the way. And by the way, the trend in my office is not, I mean, we do sometimes set the trends in the country in the office, but people are going to topical happy, which is finasteride and minoxidil, and people are going on the super capsule with finasteride and minoxidil. I mean, that's pretty much, the best you could do. Can I get a prescription from Happy and send it to my own personal pharmacy? No, unfortunately, you cannot. This is basically our trademark formula, so you cannot do that. I'm sorry. And also another thing is that we have over 12 to 13,000 patients on this formula. So and we go through a lot of trials and errors and testing. So I think our formula is really superior to like a local mom and pop pharmacy that only make 5 of these a month. Are medicated shampoos useful? Yes, sometimes they could in clinical studies. Topical ketoconazole shampoo has been shown to be as effective as topical minoxidil. Should I be using one along with Happy Head? Yes, you can. The best way to get it is to send an email to help at Happy Head and say I'd like to go on the ketoconazole shampoo. And actually, let me check the website. Do we have it on the website? Okay. Okay, so please check in with the customer service. We should probably put the shampoo on the website. Yeah, just say that I want the prescription ketoconazole shampoo. What type of styling products are harmful? Hair, sprays, gel? How does excessive washing, styling, and coloring affect the hair? Great question. So, coloring definitely could damage the hair, especially if you go lighter than darker. Excessive styling, blow drying, anything that's hot or hot liquids, it will damage the hair. And excessive washing damage the hair as well. So you gotta really watch out for those. And pulling and really basically massaging the scalp very aggressively, all those all damage. With respect to hair gels and hairsprays, look, I think technically the less you use, the better it is. I will share you a secret of what I do. For my hair, I've honestly never used any hair gels and hairsprays just because every time I used it, I broke out with acne. So the solution I came up with, I use the Aveeno lotion, the lotion or the Eucerin lotion. So I wet my hair and I use the lotion moisturizer and I put it all over and I style it like that. One, it makes my hair look really nice, and I use it as a hair gel. So and it's also moisturizing my hair and scalp as well. So I've never used any hair gel and hairspray. I don't recommend it. That's my personal opinion. Do you recommend taking the Happy at oral? So look, if you do the oral and topical, you're going to see better results. The Happy and oral, there are many different versions. There's oral finasteride, oral minoxidil, and a super capsule. We love the super capsule because it's a 3-in-1 prescription product. Again, the more you do, the better results you get. Again, as long as we try to minimize the side effects. Is there anything to help with the chemo hair loss? Should patients be on a hair loss treatment at all? So a lot of the chemo hair loss, sometimes the hair comes back. If you are a female above age 50, you could actually go on oral finasteride. And there are clinical studies showing that patients go on oral finasteride after chemo do better. The only problem with finasteride is that we don't want patients with a history of breast cancer to go on it. So you could go on oral minoxidil. And again, email us, help at Happy Ed, and we'll get you on it. What are your thoughts taking Happy oral minoxidil with Fin versus oral minoxidil with dutasteride? Which is more effective? So you're taking Happy topical with the oral minoxidil finasteride, or you're doing the Happy topical with oral minoxidil dutasteride. Either one, probably. Look, in clinical studies, dutasteride tends to work better than finasteride. So if you do the topical Happy, do the super capsule with dutasteride. Let's see. So is the 0.1% dutasteride and 0.1% finasteride kitchen sink stronger than doing the 0.3% alone by itself? In theory, it could be just because you have two different ingredients in it, and you might respond better. This is a very common question. Why don't we have the kitchen sink at the 0.3 each? I will take that to the board and we'll talk about it. I'll ask Dr. Sean, the other co-founder of the company, and let's see. We might come up with a 0.3 do 0.3 fin. Guys, thank you so much for joining us on another Happy Head call. Thank you, Evelyn, and everyone else who helped set this up. I think we are here next week again, but we'll send you guys an email if we are. Have a blessed holiday and Merry Christmas. Again, please feel free, if you have 1 minute, go on our Facebook, write us a review on Trustpilot. Your reviews really do count, a lot because, there's just honest opinions from, our patients. So thank you so much. Have a lovely day. Bye bye.